My name is Mattingly. I'm a breast surgical oncologist at Hendricks Regional Health. I have a toddler that keeps me very busy. My husband likes to bike and camp, and we're kind of a big family. I think that's a reason that I really wanted to practice here in Western Indiana. While I was a resident, I rotated with Dr. Bowling, got to know some of the breast cancer patients, got to see the level of care that was provided by these specialists, and I felt that there was a lot more humanity to the specialty than other aspects of surgery. The philosophy of care at Hendricks is a patient-centered approach. It's not just about the doctors treating the patients, it's about the patient being put at the center of the picture and us surrounding them with resources to help them through the cancer journey. The biggest question that most patients have is this a curable cancer? And I think that's something that I try to make sure we cover in that first conversation. It can be challenging to have difficult conversations with patients going through very traumatic points in their life without carrying some of that weight with you home. I met Natalie the day after her cancer diagnosis. She was understandably very emotional.
The first encounter with Dr. Mattingly made it so calming. She was so knowledgeable, but she was like a friend, and she sat knee to knee with me and talked me through it. And I just remember her saying, "This is treatable and it's curable." She told me, "I want you to keep saying that to yourself. It's treatable and it's curable."
The type of breast cancer that Natalie had was a type that's particularly responsive to chemotherapy. Natalie did 6 months of chemo and did very well, and then we proceeded with surgery a month after she completed chemotherapy.
Because we had to do chemo first, I didn't have to make the decision quickly about getting a mastectomy or a lumpectomy, and Dr. Mattingly did explain all of those choices. I knew that I wanted to do a double mastectomy with the reconstruction.
When I get to tell someone that their cancer melted away with their chemotherapy, it's probably the best news I can give. Breast cancer treatment has evolved significantly over the last 20 years, even 10 years, and it seems like there's newer drug options that come out every year. I try to make sure that I'm current with everything and also discuss with the medical oncologist if they would have any newer recommendations that would change the surgical plan from my perspective. At Hendricks Regional Health, our promise is to see patients within 1 day of diagnosis. Every woman has a story, and for us at Hendricks, it's an honor to walk with them on their journey.
Schedule your 3D mammogram at hendricks.org/mammogram.